Wheelchair management and safety. Wheelchair management and safety starts with school rules. Encourage and reinforce typical school hallway rules, such as traveling on the right side of the hall, not bumping into peers, and not talking in the hallways. Encourage and expect students to leave the classroom with their peers and travel in line to other areas of the school, even if the student is dependent on an adult to push the wheelchair. Let's look at the essential components of wheelchairs.
Hello, and welcome to our class on wheelchair management and safety. My name is Kathleen Falaska, and I'm a physical therapist with Charlotte-Mecklenburg Schools. As a physical therapist in the school setting, I work closely with children with disabilities and school staff to train them on positioning and safety during the school day. During this class, you'll learn to identify common wheelchair parts and how to use them, identify proper positioning, and also identify common mistakes with positioning. You will also learn common safety considerations during school routines and safety evacuations. I'd like to introduce you to Quinn, and he's going to be helping us today. First, I'd like to introduce you to some common wheelchair parts and how to manage them. This is the pelvic positioning strap. It is not a seat belt. Seat belts are in cars. The pelvic positioning strap helps keep the child's hips positioned back in the wheelchair seat. It also helps the child to maintain a functional upright position. The pelvic positioning strap is very important because with mobility during the school day, if the child or the person pushing the wheelchair were to stop suddenly, the pelvic positioning strap is going to keep the child safe. These are the wheel locks. The purpose of the wheel locks is to stop the wheels from moving. This is used during transfers when a student is positioned at her desk and when parked. There are a variety of wheel locks. Some wheel locks push to lock, some pull. It is important that the locks are working properly in order to ensure the safety of our students. This is another type of wheel lock. You use your feet to lock and unlock the wheels. It is important to remember with wheel locks that both wheel locks should be engaged when the chair is not moving. This is the headrest. Headrests can be all different shapes and sizes depending on the student's head control and their ability to keep their head upright. The headrest typically stays in a set position. If you notice that it is moving, you can contact your school-assigned physical therapist to assist in repositioning and tightening it. This is especially important for our students with poor head control who ride the bus. If a headrest is significantly loose, then it will need to be adjusted before they ride home on the bus. This is the anterior chest support. For children who have poor trunk control, you will see them wearing this anterior chest support. Not all children will wear one. It all depends on their trunk control. One very important thing to remember is that if you ever see the upper part up around a child's neck, it really needs to be repositioned. Also, when a child is riding a bus, they need to have this anterior chest support secured. Another feature that a student with decreased trunk control will have on their wheelchair are lateral supports. These give the student support on either side of their trunk. Some laterals have a swing-away option that assists with making transfers in and out of the wheelchair easier. This is the armrest. The armrest on a wheelchair can also assist the student with sitting upright by providing a weight-bearing surface. They can be used during transfers, and for students who are able to, can push up on the armrest to reposition his hips back in the wheelchair seat. Lap trays are typically secured to the armrest as well. Some armrests can be flipped up and moved out of the way when pushing a student up to the desk so that the wheelchair fits underneath the desk. These are the anti-tippers. Anti-tippers help prevent the chair from tipping backwards if somebody pushes too hard on the back handles. You'll notice that the anti-tippers can come out. Sometimes, at home, the parents will have the anti-tippers flipped up to help with mobility on uneven surfaces, like grass or going up and down curbs. However, when the child is at school, always make sure that the anti-tippers are flipped down. These are the footrests. The footrests give the student some support at their feet. This in turn will help with positioning at their hips and their body. The footrest can be flipped out of the way to help with transfers. You may also notice some footrests will have components that help keep the child's foot secured to the foot plate. Some wheelchairs have a tilt mechanism that can be used to give pressure relief to the student's sacrum or bottom after they've been sitting upright for long periods of time at school. Some wheelchairs will have this tilt control in the back, which you can control with a foot lever. This wheelchair, the tilt release is located on the back canes. When a student is in tilt, it can make the wheelchair more unstable. You can be tempted to hang heavy backpacks on the wheelchair handles, but this increases the risk for tipping and can eventually cause damage to the wheelchair.
Let's recap the essential components of wheelchairs. You have the pelvic positioning strap, an anterior chest support, the headrest, the wheel locks, and the anti-tippers. Let's look at how to position a student correctly in a wheelchair.
Now that we've gone over wheelchair parts and components, let's take a look at how to position a child correctly in a wheelchair. Positioning is very important. Each child has their unique positioning needs. It's very important to ensure that the child is properly positioned because it helps prevent pressure areas, pressure sores, the development of deformities, and it helps the child to be able to manipulate objects and view their educational environment. Okay, let's get Quinn in this wheelchair. Before he transfers in, we always make sure that the wheel locks are properly secured. We're going to help him get in the seat. And before we do anything, we want to make sure that his pelvic positioning strap is secured. Okay. Once it's secured, you can see if his pelvis is level by putting your hand across his hips. Once you've noticed that there's no rotation and they're level, you can tighten the pelvic positioning strap. At this point too, you want to make sure that his hips are all the way back in his seat. We do this by leaning him forward and checking to see if his hips are making contact with the wheelchair back. Okay, let's sit on up. We're going to flip the footrest back into place to give him a nice firm support surface. At this point, if there were any heel loops, you would want to secure those at this time. From here, we're going to flip the laterals in, and now we'll adjust and secure his anterior chest support. When putting the anterior chest support on, it is very important to clip the bottom clips first. Once they're clipped, you want to go ahead and tighten them up. This will make sure that the top part of the anterior chest support won't be coming around the child's neck. From this point, we're going to go to the top and clip those clips. And from here, we'll give them a nice tug and firm them up. This will help keep the child's chest upright while he's positioned in the chair. I think he looks pretty good.
Let's recap how to position a student in a wheelchair. Make sure you engage both wheel locks. Sit the student's pelvis back as far back as in the chair as possible and make sure it is level. Secure the pelvic positioning strap snugly. Lean the student forward to check the pelvis position and make sure it is making contact with the back of the seat. Secure any additional straps, such as the anterior chest harness. Let's look at how to position a wheelchair at a desk.
When pushing a student up to a desk, you want to make sure that the table height is positioned so that the student's elbows are at about a 90-degree angle. It is difficult to write if your arms are up at your chest. You can also flip the armrest out of the way to move him as close to the surface as possible. The other thing that you want to make sure that is secured are the wheel locks. This will help him from not moving back and forth as he writes.
Let's review how to position a student at a desk. Make sure both wheel locks are locked or the power is turned off for a power chair when positioned at a table or a desk. You want to position the wheelchair 1 to 2 inches from the edge of the desk. You can flip up the armrest to allow the wheelchair to get closer to the desk. Adjustable height desks are also available through the physical therapy department if needed. Let's look at some safety guidelines for wheelchairs.
It's time to take a look at some safety considerations for children traveling in wheelchairs during the school day. First and foremost, it's important to make sure that their pelvic positioning strap is securely fastened. When pushing on the sidewalk, you want to take care to make sure that you stay away from the lip where the concrete meets the grass. It's very easy to let that first caster roll off, and if that were to happen, it would be very difficult to maintain and keep the wheelchair from tipping over. Another thing that you want to make sure that you take in consideration when pushing a child outside is not stopping on an incline. If you mistakenly took your hands off of the child's wheelchair while they were parked on an incline, they would start rolling. This could end up in a very disastrous situation. So always make sure that the wheel locks are secured and you have both hands on the wheelchair at all times outside. Anytime that you are outside and near a curb or stairs, you want to make sure that the wheelchair is positioned away from it. It is very easy for one of the chair wheels to tip over and fall, and this would have disastrous consequences for the child. I'm often asked if it's okay for a student or a peer to push the child in a wheelchair. If that student has good safety awareness and has been picked by the teacher and the school-assigned physical therapist, that peer can be trained on the proper procedures for pushing a child in a wheelchair in the school. It is not okay to have any child push a child in a wheelchair outside. This should always be done by an adult. Keep in mind that a majority of the accidents occur outside and are completely preventable by following a few simple guidelines. 1, always make sure that the pelvic positioning strap is secured, that the wheel locks are engaged, and that you stay away from stairs, curbs, and inclines.
Let's review some of the safety guidelines for wheelchairs. The pelvic positioning strap should always be secured. Whenever parking the wheelchair, even if leaving the wheelchair unattended for a brief time, both wheel locks should be engaged. Locking only one wheel is not sufficient to keep the wheelchair from moving if it is bumped. Never let go of the wheelchair or park the wheelchair on an incline, near steps, curbs, or on uneven surfaces. Do not allow another student to push a wheelchair outside. Let's review emergency drills now.
During a fire drill, it is important that the child in a wheelchair tries to follow the same route as his typically developing peers. If that child happens to be on an upper level, he would be escorted to the area of rescue, which is designated by the fire marshal. At that time, an adult would stay with the child until the fire company comes to rescue the child. During a tornado drill, you would have the child in the wheelchair be escorted outside in the hallway with his typically developing peers. Have the wheelchair face the wall and make sure that that child bends forward into the duck and cover position. You can help the child if they are unable to do this. During a lockdown procedure, you would have the child in a wheelchair follow his peers into a corner of the room that is not visible from the door or windows, and have them sit quietly with his classmates until the lockdown procedure is completed.
Let's review emergency drills now. For a fire drill, assist the student to exit the building with their peers. If they're on an upper level, escort the student in a wheelchair to the designated area of rescue. For tornado drills, assist the student to park the wheelchair facing the wall with the peers and lean forward if able. During lockdown, assist the student to park the wheelchair with their peers in an area of the classroom that cannot be seen from the door. If you have any questions regarding wheelchair safety, please contact your school-assigned physical therapist.